what you see when you say a person is aging, or maybe not aging so very gracefully or so very nicely that you want them to age, what you actually see, the first sign is dry skin. That's when you know you've started aging. Then you have dyschromia, which means difference in the skin color. Then you have difference in your skin tone, which doesn't feel so tight anymore. Also, we need to understand it's not just about the skin which ages, things which also undergo changes underneath the skin. The first thing most of you would have noticed is under the eye, it feels like a depression, isn't it? So that's the very first thing you see because of the loss of fat there. Then you have your features which don't get defined very much. Your brow starts drooping up, your corner of your mouth starts drooping. It's all a cascading effect once it starts in. Then you have your blood vessel, your muscles slack, your skin becomes very, very thin. All of these changes lead to aging. Topic of my lecture today is to make you understand the procedures which are done towards anti-aging, not the creams and the potions on its own.
Most of the times we as Indians are highly apprehensive. Whatever we are doing, it's only because of that one particular Botox. So I think that's the commonest thing we come across, and I think I'm practicing in Delhi for 7 years, and that we have seen it's invariably not associated with, and people with migraine, they respond beautifully. Our anxiety levels are so high that we tend to think that everything that is happening is because of that single shot.
I have been one of the pioneers to bring Botox to India, and I've been working for 12 years with Botox. See, there's some things that can be scientifically analyzed and explained. But for a headache to happen because of this drug, or panic attack or BP to raise so much the way you're talking, there's no way we can deduce it scientifically. I'm here with the Prevention Week because I was informed this is the most well-informed audience, and so we thought we'll start demystifying most of the commonly used procedures and tools in cosmetic industry today, like the Botox, the fillers, the lasers and the works. We also ended up doing a bit of live demo of Botox, and patients are very happy to take it. It was painless. Basically the idea was to show how simple and how it's just an office procedure to do, no bleeding, no mess, no bruise. Botox is a drug which is also used for a lot of health indications, a lot of indications wherein there's regurgitation of gastric fluid. We end up giving Botox there. Botox is used for children for spastic spasms. So Botox is used for squint. So it's used for various other indications. Botox has nothing to do about age. It's when you see is when you address it. So you could see your lines or probably your expressions which are not so lovely at 16. Maybe you could see it at 60. So when you see, you reach out to your doctor and then voila, it can be done.